Hello everyone and welcome back to the sphenoid, and now we are going to start with the greater wing of the sphenoid. The greater wing has got a superior or a cerebral surface, and it has got an anterior or orbital surface, and it has got a lateral surface. Let us look at the surfaces first. This is the anterior or the orbital surface, and then again you have a lateral surface over here. Let us go back to the anterior or the orbital surface. Now you can see that this orbital surface of the greater wing has got a medial border, inferior border, a superior border and a lateral border. And you can make out that this superior border articulates with the orbital plate of the frontal bone. The lateral border articulates with the zygomatic bone. The medial border is free, forming part of the margin of the superior orbital fissure, and the inferior border is free, forming part of the margin of the inferior orbital fissure. At this point there is a small elevation which gives attachment to the common tendinous ring of the recti muscles of the eyeball, and this also encloses the optic nerve and the ophthalmic artery. Now this common tendinous ring divides the superior orbital fissure into three parts. Through the lateral compartment you have the passage of the lacrimal, frontal and trochlear nerves and the superior ophthalmic vein. Through the middle compartment you have the passage of two divisions of the oculomotor nerve, the nasociliary nerve and the abducent nerve. Through the medial compartment you have the passage of the inferior ophthalmic vein. Now the inferior orbital fissure is completed by the maxilla in front and the zygomatic bone to the side. And through the inferior orbital fissure you have the passage of the infraorbital nerve, the nerve and vessels, the zygomatic nerve and orbital branches of the pterygopalatine ganglion, and a vein connecting the inferior ophthalmic vein with the pterygoid venous plexuses. And now if we go back to the superior view over here, you can see the cerebral surface of the greater wing of the sphenoid, and you can make out that it has a posterior border over here, and it has a squamous border or squamosal border, and it has a triangular rough area medial to the apex. This is the apex of the greater wing of the sphenoid, and there is this triangular area medial to the apex over here and over here. Now if you go by the articulations, then this squamosal border articulates with the squamous part of the temporal bone. The apex of the greater wing of the sphenoid, it articulates with the anterior inferior tip of the parietal bone, and this triangular area over here articulates with the frontal bone. And if you go to this posterior border over here, you can make out that the medial part of this posterior border is non-articular and the lateral part is articular and it ends at the spine. Now this medial part of the posterior border forms the posterior margin of the foramen lacerum in the base of the skull, and from behind the foramen lacerum is completed by the apex of the petrous part of the temporal bone, and through the apex of the petrous part of the temporal bone emerge the internal carotid artery which goes above over here, and the auditory tube which goes below. And this foramen lacerum is actually closed by a plate of cartilage, and a few veins may pass through this foramen lacerum. So this is about the posterior medial part of the posterior border, and this foramen lacerum also leads on below, although you can't see it here, to the pterygoid canal at the root of the pterygoid processes. Now this lateral part of the posterior border, it articulates with the anterior border of the petrous part of the temporal bone. So the petrous temporal actually insinuates itself into this angle like a wedge. And if you look at the cerebral surface of the greater wing of the sphenoid, you can see the markings of the meningeal vessels, and this cerebral surface lodges the temporal pole of the temporal lobe of the brain, and on this surface you can see a series of openings from medial to lateral. The medial most of this is the round opening, foramen rotundum, which transmits the maxillary nerve, and it opens into the pterygopalatine fossa, following which you have the foramen ovale, which transmits the mandibular nerve, accessory meningeal artery, lesser superficial petrosal nerve, and emissary vein connecting the cavernous sinus with the pterygoid venous plexus. And in many cases, the anterior limb of the middle meningeal sinus drains through the foramen ovale. Then the next large opening towards the spine is the foramen spinosum. It transmits the middle meningeal artery and the nervus spinosus. Apart from that, you can have this opening. This opening is called the canaliculus innominatus. And if you have this opening usually transmits the lesser superficial petrosal nerve, which instead of going through the foramen ovale may go through the canaliculus innominatus. And then you may have between the foramen rotundum and foramen ovale somewhere here the foramen of Vesalius or emissary sphenoidal foramen. In that case, the emissary vein connecting the cavernous sinus and the pterygoid venous plexus, instead of passing through foramen ovale, may pass through this foramen of Vesalius. And again, you can make out that here anteriorly between the greater wing and the lesser wing, you have the superior orbital fissure. You can't see it on this side, but you can see it on this side, that between the greater wing and the lesser wing, you have the superior orbital fissure. So these are two views of the upper surface of the greater wing. Now if we go to the lateral surface, on the lateral surface of the greater wing there is one surface which faces exactly laterally, that is the temporal surface, and one surface which faces inferiorly, so you can't exactly see it, and they are separated by a structure here called the infratemporal crest. To this temporal surface of the greater wing you have the attachment of the temporalis muscle, and to the infratemporal surface over here you have the upper attachment of the lateral pterygoid muscle. So that's so much for the greater wing of the sphenoid. Next we will study the lesser wing and the spine of the sphenoid.